Okay, welcome back again. Today we're going to be talking about antipsychotics. Antipsychotics is a high rating area. You do get questions in your GPhC exam from this specific area of your BNF. So here we go, exam predictions. We're not covering every single thing on the chapter. We are focusing on the common ones that do come up in the GPhC exam. So here is a table that I've put together for you. This table is an amazing summary of some of the common areas that get tested when the GPhC tests you on antipsychotics. So here's my lovely table for you. The first thing you need to know are the different side effects of your different antipsychotics. Metabolic side effects, especially for your new generation antipsychotics, because the old generation antipsychotics tend to cause a lot of extrapyramidal side effects. But the new generation, such as clozapine, for example, have more metabolic side effects. So here are the ones that get tested in your GPhC exam. Number one, weight gain. They're going to ask you questions. Which of these antipsychotics causes weight gain? Or which one is responsible for this patient gaining weight, or why you need to monitor the patient's weight? I use a mnemonic called COW. So C is for clozapine, O is for olanzapine, and W simply means weight gain. So it helps you know that the two main ones that cause a lot of weight gain are clozapine and olanzapine. You need to avoid these, and you could give the other ones in green. So what I've done is I've put a table down for you. Everything in pink is what in the middle column is what you need to avoid for that specific side effect, whilst everything in green are the ones that you can give instead. So second question, they may ask you, if it's not a question on weight gain with an antipsychotics, it may be a question on hyperglycemia or diabetes. Which antipsychotics are more likely to cause hyperglycemia? Risperidone, quetiapine, clozapine, and olanzapine. There are some commonalities when you look at some of these antipsychotics, especially clozapine. You can see clozapine coming out in a lot of avoid sections, which we're going to look at clozapine later, because it's one of the popular ones that GPhC loves to test you on. So you need to know which ones cause diabetes, and then you need to know what to give instead. Next thing is postural hypotension. There we go. Clozapine again, close the door. Clozapine and quetiapine. These are the ones that cause most postural hypotension. Then you have the ones that cause more hyperprolactinemia, risperidone, amisulpride, sulpride, and mainly your first generation antipsychotics. So all antipsychotics will cause some level of cardiac side effects, QT interval prolongation, which does get tested in your exam, especially in extended matching questions. So watch out for that as well. Please learn these and then learn what to give instead. Now, majority of the time, they may also test you on EPSE, which is extrapyramidal side effects, which we're going to look at in the next slide. But with these ones, they're mostly caused by your first generation antipsychotics. So it's also worth knowing which ones are first generation and which are your second generation. Then those that affect your sexual function, you're looking at risperidone, haloperidol, olanzapine. Very important that you learn this table, you master it, you understand this table, because where you see blue GPhC exam, blue right here, I'm going to draw that so I could see where you see blue GPhC exam. This is because in the past this has come up in different GPhC exam papers. So please do make sure you learn this table inside out. So next I want to focus on is the EPSE, extrapyramidal side effects. You need to know what these are. For example, I use a mnemonic ADAPT. These are your extrapyramidal side effects. So A is for acute dystonia. I need to know what that is, involuntary muscle contractions. Then you have akathisia, which is characterized by inner restlessness, inability to sit, to stay still, and to sit still. And then you have Parkinsonism, which is just generally signs of Parkinson's disease, a lot of shakes. Then you have tardive dyskinesia, which is just a late onset side effect, characterized normally by very involuntary, repetitive sort of movements in your face, your tongue, your mouth, your extremities. So it's important that you know your different types of extrapyramidal side effects and also the definition of each of them. A good place to learn them is to go onto YouTube, type extrapyramidal side effects, and you can visually see what this actually look like in patients. The next drug I want to really focus on, because for the last few years, the GPhC has really tested you on this specific antipsychotic, and it's no other than clozapine. Ladies and gents, you do yourself a favor by learning this drug inside out for your GPhC exam. So here are the key things I want you to learn, and that gets tested in your exam that's come up in previous exams on clozapine. Number one, you need to know the MHRA warning. Get your BNF, go on to MHRA warning under clozapine, and learn every single MHRA warning on this drug. It does get tested. So number one, it causes potential fatal risk of intestinal obstruction. To make it simple, it causes constipation. So patients on clozapine, if a patient is on clozapine or they give you a question in the exam, the patient takes a couple of medications and this patient has some sort of constipation, then it's most likely it is clozapine causing this. Another thing with clozapine, although it's not a narrotherapeutic drug, you do need to monitor this drug just like you do with narrotherapeutic drugs. Why? Because you have to monitor the blood concentration for toxicity with clozapine, and especially in certain clinical situations. So you need to know which are these clinical situations. So we're looking at smoking, stopping e-cigarettes, stopping smoking, switching to e-cigarettes, pneumonia, or serious infections. Patients that have any of these need to be monitored. You need to monitor clozapine because there's an increased risk of toxicity. Another side effect of clozapine that does come up in your exam is this one over here, granulocytosis. Increases the risk of blood disorders. Please learn this. This gets tested. These are the sort of areas that get tested from this chapter, especially when it comes to clozapine. So there are more points that I'd like you to learn about clozapine that get tested, and here are the points that I've put together to make it easy for you on the slide. The first one is clozapine is normally given as the last option after you've used 2 antipsychotics. And out of these 2 antipsychotics, one has to be a second generation antipsychotic. For example, they give you an exam question. A patient has tried different antipsychotics. The first one the patient tried was quetiapine, and the second one the patient tried was probably say olanzapine. So what is the next option to give this patient to optimize the patient's treatment? And they give you different drugs. The correct answer, which is come up in the exam, is clozapine. Clozapine is the last option. Hence the reason why I use this mnemonic called close the door. Close the door. Clozapine simply means it is the last option antipsychotic. Again, remember the conditions after the use of 2 antipsychotics, and one of these have to be a second generation antipsychotic. I mentioned about intestinal obstruction, which is an MHRA warning, which is a very important side effect to know about this drug. Hence the reason why we have constipation. Please learn this when it comes to clozapine. Then finally, we talk about what you need to measure, what you need to monitor. This is when you monitor the blood concentration or the blood levels of clozapine in the body, especially patients that have stopped smoking, because that could increase toxicity, could increase the amount of clozapine in your system. Patients switching from cigarettes to e-cigarettes, patients that are seriously ill, for example, the patient's got pneumonia or any other serious infection, patients which have medications that may interact with clozapine, or patients that gain weight or got diabetes. All of these patients require monitoring, as they could all alter the concentration of clozapine in the blood. Very important. The next thing I want to look at is another drug. It is a high-risk drug. It's a narrotherapeutic drug. They also love asking you questions on this drug. We normally have a number of GPhC questions that have come up in the past on this specific drug. Hence the reason why it's coming up right now. Lithium. Lithium is a very, very important drug that gets tested all the time. But what do you have to learn when it comes to lithium for your GPhC exam? The first thing you need to know all the side effects of lithium. So all the side effects of lithium, you need to know this: thirst, tremors, hypothyroidism. So this is one that has come up a few times. It can cause weight gain or fatigue. It can cause hypothyroidism. So please learn this. Another area are the interactions with lithium, which we're going to look at later on. Has come up in a few exams. Interactions with NSAIDs, interactions with ACE inhibitors, with ARBs, with diuretics, with antacids. Hence the reason why I've got this in blue GPhC exam question, because this has come up a few times. Then upset tummy, muscle weakness, skin effects. But those interactions are very important. Signs such as tremors, thirst tend to come up in your exam, and hypothyroidism with lithium. So here's what I've done. I've put together a few slides all in one page just to make it easy for you. Remember, you're going to have access to all these slides for those of you that are on, say, the premium package, or if you're on the VIP package, you get access to these slides. Sorry, not VIP. If you're on the premium, you get access to these slides. So here is the first thing I want you to learn. I want you to know that with lithium, they do test you on the patient and carer advice. When it comes to patient and care advice, a high weighting area of your exam is to know which drugs need to be prescribed by brand. And one of these drugs is lithium. So you need to maintain patients on the same brand. This could potentially be an extended matching question in your exam. Which of these drugs needs to be prescribed by brand, which has come up in the past. Then another thing is the effect of lithium on your electrolytes. Now, many people get this confused because they think that lithium causes hyponatremia. That's not what we're saying, but instead hyponatremia increases the risk of you getting lithium toxicity. So hyponatremia will predispose patients to lithium toxicity. And GPhC has tested patients questions on this already. They may test you again. So avoid dehydration or anything that changes sodium levels. Hence the reason why we need to be very cautious when we give patients diuretics and lithium as well, because that could increase the risk of hyponatremia, and hyponatremia in return increases the risk of lithium toxicity. Next thing is this interaction. I've put the main ones for you together. There are obviously more interactions with lithium, but again, these are all about exam predictions, and these are the ones that come up the most. So the following drugs could increase lithium toxicity: ACE inhibitors, it has come up in your exam, diuretics, NSAIDs. The GPhC loves to test you on pump meds that interact with P or GSL medications, and this is a typical example. A patient that's bipolar comes to your pharmacy to buy maybe ibuprofen for a headache. You will need to check PMR, and if that patient is on lithium, what do? So these will increase the concentration of lithium. So you want to give them a different painkiller, probably paracetamol, or if that patient cannot take anything else than an NSAID, then they have to monitor. You need to counsel them on monitoring the signs of lithium toxicity. Interactions with metronidazole, with amiodarone, with tetracyclines. So these are important. You need to know what increases lithium toxicity. And then you also need to know what decreases lithium toxicity. Again, could be a potential question. You've got antacids that are P meds or GSLs. So you need to know there's a good test you on this. And most of these soluble and effervescent sort of tablets are very high in salt. These could all decrease the concentration of lithium. So please learn this. And also there are certain drugs that cause neurotoxicity with lithium. And these drugs are carbamazepine, antipsychotics, SSRIs, triptans. Again, they love to test you on this. Most of these drugs will cause some sort of hypokalemia, which then prolongs QT interval. So please learn this. This is very important. Remember, you have all these slides. You have access to all the slides. So if for some reason my video is obstructing part of the notes, don't be worried about this, because you can just go onto the slides. If you're on the VIP package, you have access to the slides, jump on the slides, access them. They're all on there for you. I hope this helps. It's a big topic. It's a big one, but I've done my very best to give you the most important thing that you need in just about 15 minutes. Look forward to seeing you in the next video.